Hey, everybody. Let's go ahead and open it up to questions and answers and anything you want to talk about. You can unmute yourself or type in. So go ahead and fire away.
And then go ahead, Robert, then Troy.
Hi.
Hey.
Hey, I'm looking to see if my dad has joined yet, and I do not see him. And I need him on this call. It's about him. So let's see. I don't see him. Can you pass on me, Sam, and come back?
I was just gonna say, as soon as you come, just jump you in. Yep.
Thank you.
Oh yeah, there he is. Yeah, sorry. Go ahead, Mel.
Okay. So my dad's on this call. He has a little thing to tell you about what's going on. And then we invite any ideas you have, Greg.
Okay, sure. What's going on?
Good afternoon. I'm an 89-year-old male. I've been married for 66 years and I'm in reasonable health.
Okay.
For the last 25 years, I've been primarily treated for cardiovascular issues, including a triple bypass, aortic valve replacement, and 9 stents.
Wow.
I'm also being treated for polymyalgic rheumatica, PMR, and neuropathy. Okay, multiple medicine routines have been employed to control my day-to-day high blood pressure.
Okay.
With various combinations of medicines, my blood pressure would average 135 to 150 diastolic.
Okay.
4 months ago, this changed with BPs in the range of 100 to 125 diastolic, with a few outliers as low as 90 D. My doctor is currently doing further detailed evaluation on this low blood pressure, but he has no explanation for the situation. But my medications have been changed slightly to help with this different problem. There have been changes.
So what's the blood pressure now? Like what's both numbers? Like,
Well, right now it's 100 to 125.
Okay.
And there's outliers down to 90. And the last thing, there has been significant changes in my energy and stamina levels since the onset of the low blood pressure. Along with that, my sleep and breathing have also been impacted negatively. Are there any essential oils that could help?
So two things, because the breathing was actually going to be one of the very first questions that I was going to ask. Sometimes what happens with going through and treating these things and having these issues over the years is that there'll start to be an issue with the medulla oblongata. And this affects like blood pressure, it affects circulation, and it affects your respiratory system, like your respiratory rate and things like this. And so when there starts to be issues with that, the tendency is to have like the blood pressure goes like low, the tendency is low blood pressure, and then you could say irregularities with the respiratory tract. Not necessarily like bronchitis or asthma. It's just like the breath sometimes is like shallow, or you're not breathing like with a hard respiratory rate. The respiratory rate can get a little too slow sometimes. Sometimes it can speed up. I mean, it depends. But did they have you on statins? I would imagine thing going on. Statins.
Yes.
So the other concern would be the side effect with statins sometimes is muscle weakness. Muscle weakness can happen, but one of the things with statins is it diminishes coenzyme Q10 in the body, which is something that our body like generates and uses for, you know, certain processes, and then also with like maintenance in the body. And so some of the medications might also have depleted some of the coenzyme Q10. And the other thing with coenzyme Q10, it does help with cardiovascular function, and it also has to do with energy levels. And so, I mean, some of this could also be that. So I mean, I would start off really slow just to see what was going to work. But there'd be a couple of things that I would do that would be safe and not really interact with medications or anything like that, so we don't complicate anything. And one would be, I'd take probably, I mean, I'd probably start off with like 400 milligrams, but I'd probably go up to like 600 milligrams of ubiquinol, which is a type of coenzyme Q10. Like it's more able to be assimilated very quickly in the body. And I think that could actually have quite a positive effect on you, like on your body and how you feel and energy levels. And then the other thing is that I would have you use hyssop, and hyssop inhaled like probably 2 to 3 times a day. You know, long, slow, deep breaths with it up towards your nose. You could actually also apply a little bit to the skin, like, you know, maybe 3-4 drops. You could just do that on the wrists, or if you want, you can rub it on the back of your neck. But the reason being is that the hyssop helps to like stimulate proper function within the medulla oblongata. And so it will help to regulate the respiratory rate. It will help to regulate this low blood pressure. Like sometimes, like hyssop doesn't necessarily raise blood pressure, but if the blood pressure is low, it will help to like balance out the blood pressure to make it, you know, not so low. And so that would be the very first thing that I would try. Are you having any digestive issues at all? You having like poor digestion, nausea, diarrhea, anything like that?
Not really.
Okay.
I'm sensitive a little to diarrhea, but that's not been an issue.
Okay, because the other thing would be the vagus nerve also comes out of that area, and sometimes the vagus nerve could have a little bit of, you know, just from wear and tear of the years, can have a little bit of like poor tone, and that would affect quality of sleep. That would affect a little bit of your digestion. That would affect like stress responses, like tension in the body, things like this. And so if that was the case, I would still have you use hyssop, but then I'd also augment with having you inhale a little bit of marjoram, and then apply several drops of marjoram to your abdomen, like once or twice a day. You know, are you getting any cramps or anything like that, like in your calves or your calf sore, anything like that?
No,
Okay, good. I'm sure your doctor's probably watching that.
I hope so.
Yeah. Because I mean, given your cardiovascular history, I guarantee you he's looking at those. Yeah. So okay. I mean, those are the things that I would just do right off the bat. And a lot of times the treatment with the hyssop, you know, it might take a little tiny bit to bring things around, but I think that combined with the ubiquinol, I think that could be resolved. I mean, it doesn't always mean that that's the case, but I mean, it seems pretty like the parameters are kind of clear, like what's kind of going on, and that you've been on statins for probably a long period of time.
Yes.
I guarantee like coenzyme Q10 goes down as we age, but then being on statins usually reduces it quite substantially. And so at some point when somebody's on statins, you have to supplement at some point because of the depletion that it causes. You're describing some of the deficiencies, like the symptoms are kind of deficiencies. And the thing is it's not a medical condition, it's a functional condition, so it's not usually looked at by, orthodox medicine and everything, but just functionally, supplement a little bit with that and the hyssop. And like I'd say, within about a week or two, let's maybe hear a follow-up and see how you're doing. But it's probably going to take a good 2 weeks to 4 weeks to really see some solid results. But I would say very quickly, within a day or two, you'll start to notice like, I'm starting to feel a little bit better. You know what I mean?
Wonderful.
So the thing is like 200 milligrams of Biquinol will increase the coenzyme Q10 levels in your body. Like if you do it over 30 days, it has the potential to raise it up more than 100%, like 120, 130%. If you go up to 600 milligrams, it raises it up by like 750 to 800%. And so I don't know that you need to be that aggressive, but 200 to 400 milligrams is pretty solid. I mean, when people have like pretty severe like blood pressure issues or congestive heart failure, I usually put them on like 800 milligrams. And so 400 I think is pretty solid, and we'll see how it makes you feel. After a couple of weeks, we'll bump you up to maybe 600 milligrams, and then go from there. Yeah.
Thank you very much. I
You're so
appreciate
welcome.
your input.
Keep us posted and let us know how you're doing.
Okay, thanks again. Bye-bye.
Mhm.